You are watching the DocTalk show.
Happened to get rheumatic heart disease. We noticed the symptoms way back in 2017, around December, when he complained of having chest pain. So we thought maybe the pillow was uncomfortable, we had to change the pillow. But it persisted for about a week. And then we had to see a pediatrician who finally looked at him, checked him. That was Dr. Morozi, and then he referred us to the Heart Institute. So when we reached the Heart Institute, they carried out tests, echo, ECG, and they discovered that he had two valves that were leaking. One was severe, and the other was mild. So we finally had him operated last year in January, that was 2018. He went through the operation. It was a very successful one. But one thing I just want to talk about rheumatic heart disease. You know, it is such a simple thing. And sometimes I don't know, I feel like slapping myself in the face for something that is so simple that you don't even need more than 10,000 shillings to treat. But because we don't know about it, our children have permanent impairments because of something simple, a sore throat. And many of these children get them. But because it is not something that a child will complain about, we ignore them. But that is the whole cause of it. It is a simple infection which is treated by a simple antibiotic for about 10,000 shillings. But because we ignored it, we didn't look at it as, we didn't have the information. So it costed us all that. It costed his life. It changed his life because now he has to be on drugs forever. Those mechanical valves, in about maybe 20 years again, he will have to go on the operation table and they change them. So that is what rheumatic heart disease is. It is something, if parents, we took keen, when a child comes to you, once in a while, especially when they have a cough, tell them to open their mouth. If it is red behind there, please don't take it simple. It is such a simple thing, but it may go into a very complicated thing.
It started with some joint pains, the chest pains. I would complain, and I would take some drugs, but it wouldn't work. I would like to treat a rheumatic heart fever and help everyone.
You are watching the DocTalk show.
Are there ways we can prevent this in the first place? The child doesn't have to be born with a defective heart.
So, of course, number one is antenatal care. And family planning, even before antenatal care. If you're planning to get pregnant, you need to prepare 3 months prior to that pregnancy and start taking folic acid that is given to you during antenatal. So for the first 3 months, you're on the folic acid. It reduces, prevents congenital heart diseases by 80%.
This component is very important in development.
Yes.
Okay,
The
so
folic
using
acid.
it, yes, exactly. Using it during pregnancy and even before pregnancy facilitates normal growth of the different body structures.
Yes. Yes.
Okay.
So folic acid taking, and then prevent, the mother should not take alcohol during pregnancy. If you're going to undergo any radiations, make sure you're not pregnant.
Or at least
Or tell
inform
your
the
doctor. Tell them I am
you're
pregnant.
expecting.
Yes, so that you're not exposed to radiations. For the genetic syndrome, sometimes that is a little difficult. We take families through genetic counseling and tell them that, you're more predisposed to getting a child with congenital heart disease, or if you've had a previous child with congenital heart disease, especially the complex ones, we encourage them to have early screening. For instance, you had a very complex heart disease and child died, say, in the first just the immediate days after delivery. Then even during your pregnancy, you want to do all those things, and even when you deliver, have the child screened for congenital heart diseases. Yeah.
Yeah, so at least the mother should be able to interact with the doctor, explain whatever drugs they're taking, even some of the herbal drugs. We do not know if they cause heart problems, but
We do not
it's
know
very
the components
common,
of those drugs.
and
Yes.
it could cause some problems.
Yes,
So the mothers have to be open to their doctors, discuss with them whatever worry or concern they have. If they're on some medicine, they ask the doctor, doctor, I'm on this medicine. Is it safe for the pregnancy? Yes, and that way they can prevent some of the congenital problems from developing. So how about the acquired? For example, the rheumatic, you said it's the most common, it's the biggest cause of the acquired heart conditions in children.
One of the ways to prevent it is to improve on ventilation of whatever environment you are in. Number two, of course, we have to make sure that for these children, since the infection manifests with the flu, itching throat, painful throat, parents recognize this early and take children to hospitals.
And that's preventing the child from getting the heart disease.
Exactly.
Now, sometimes there are those who keep getting these rheumatic fevers. Are there some ways they can prevent themselves from getting the heart disease? It is like a progressive stage, so they're kind of like in the middle there, they're at risk. Are there ways they can prevent themselves from getting the heart disease?
So if one is getting recurrences of rheumatic fever, even just by first episode of rheumatic fever, there is an injection that we give, a monthly injection. We call it a benzathine penicillin. That injection has proven to prevent recurrences of rheumatic heart disease, of rheumatic fever, and also treats rheumatic fever. So whoever gets a single episode of rheumatic fever is given a monthly benzathine injection up to about 10 years from the previous episode.
And that will protect them for that
and
time.
you need to adhere. It's, for instance, one takes antiretroviral therapy for life. But this is not for life. This is about 10 years. And it prevents the permanent damage of the valves.
So Ugandans should know that there is a government body called the Uganda Heart Institute, which deals with the management of all heart conditions in the country. And we also extend it to people who are outside the country. So our advice is every time you have your child manifesting, presenting like they have something to do with the heart, go to the nearby hospital, get screened, and when you are referred to Uganda Heart Institute, please come. Don't say I will go another day. Please come as early as possible so that you can get the treatment before the child develops complications. Then, of course, I would like to emphasize that Uganda Heart Institute has a program. We call it the outreach program. In this program, we go to the different parts of the country, mainly the regional referral hospitals, and also other hospitals out there. When we do this, we're trying to bring services close to you. Please attend. When you hear there's an outreach program, use that opportunity to take all the children that have been screened before, all those you are worried about that may have a heart disease, and they get screened.
Health workers out there and those well-wishers, we have an umbrella body that we call the Uganda Heart Association that brings together heart specialists, intensivists, cardiac, all those specialists of the heart within this country. Not necessarily in the Uganda Heart Institute, because we've been able to have people placed in different places. So we have a congress, we call it the annual UHA Congress, that will take place on the 21st and 22nd of February at the Imperial Royal Hotel. We're inviting health workers, pediatricians, physicians, gynecologists. Will be hosting the president of the World Heart Federation during this meeting. And this lady, of course, the World Heart Federation is the key body that puts all the heart specialists in the world together. So we are honored as a country to have
be hosting this
Prof.
very big
Silva.
conference.
Yes. So she'll be giving a keynote address on heart diseases, the unique nature of women's hearts. So of course in this meeting we've talked about
many children, but I think in a future show we'll talk about the heart problems
women.
in adults.
Because some of them have actually rheumatic heart disease that is diagnosed during delivery. So this is something that would be very good for obstetricians and whoever is interested to come and attend.
So thank you very much. We thank our heart specialists in the studio, Dr. Lamek Smogeri and Dr. Namuyonga Judith. They both work at the Uganda Heart Institute. We hope the show has been very educative to you. Remember, if your child has these signs and symptoms that would suggest heart disease, please take them to the nearest hospital. They get screened, and if they identify to have a heart problem, they will be referred to the Center of Excellence at Uganda Heart Institute, where they will receive treatment and stand a chance to live a better life. So you can send in your questions or comments on our social media platform. That is on Facebook or Twitter. You can also log on to, subscribe onto our YouTube page if you want to rewatch some of these videos that have aired on the DocTalk show.
You are watching the DocTalk show. Insights from a malaria specialist, Dr. Maya Lugemo.
As far as we are concerned, malaria is a disease, a manifestation of a result of an infected mosquito bite into humans.
The DocTalk show profiles Uganda's healthcare sector. Today on the DocTalk show, we profile the Uganda Cancer Institute. The institute's main block is located along Upper Mulago Hill Road in Kawempe Division in Kampala, approximately 2.8 miles northeast of the Central Business District. The institute has made significant growth strides thanks to the government of Uganda's efforts, from a mere unit in the 1950s to an independent institute since 2005. And today, Uganda Cancer Institute is proudly a center of excellence in all of East Africa, and it's considered Sub-Saharan Africa's most comprehensive cancer response institute.
In cancer, in the management of cancer, the first step in management of cancer is actually diagnosis. And the diagnosis is actually achieved with the imaging. When we image, we are able to anatomically localize the site, the size and the extent of the tumors which are people's bodies. And we can also ascertain the functionality of these tumors. We can also use imaging to pick tissues of the tumors, and they are taken to the lab for analysis to confirm or dispute the presence of cancer. Imaging is also used to stage cancers. Staging a cancer means establishing the extent. There are mainly three modalities of treatment: chemotherapy, radiotherapy, and surgery, or a combination. When patients come, first of all, we see them, we detect their cancer with imaging. We go ahead to pick tissues to confirm the cancers. Then those patients are sent to their doctors for treatment. When those patients are sent to doctors for treatment, then they come for us to stage, and we stage the tumor. We show the extent of the tumor, and that's when they determine what mode of treatment is treated. Even during the course of treatment, those patients again sent us to assess how responsive is the cancer, the treatment they are giving. Is it treating the cancer? Is the patient responding or the patient not responding? Even if the patient is not responding, when the patient is not responding, the doctors again have to sit down and advise the method of treatment. And in conditions where patients are responding, the patients again sent to us for us to establish whether the cancer is completely cured or it is still some residual. If it's cured, that's when we say that the patient is in remission, and that's what we imaging. So you find that imaging is part and parcel of cancer management. All the technology ultrasound we used to use maybe I can say 4 years ago, and an X-ray which was actually an old function the X-ray, all the technology. But currently, we have the state-of-the-art X-ray. It is a digital fluoroscope equipment, which I would say it is the one in the region. So our CT scanner is both a CT scan for diagnostic and can also be for a CT simulator for reduced radiotherapy. So we also have a mammography. and the mammography is actually is mobile, and we have actually two ultrasound scans, the most modern equipment which can be used anywhere in the world. The ultrasound scan, one is mobile and one is static, and in future we tend to acquire an MRI. We're also moving towards radionuclide imaging, the PET-CT scanner, and probably molecular imaging. X-ray we can do around maybe not more less than 8 X-rays a day. Ultrasound we don't do less than that ultrasound scanners a day. CT we don't do less than 20 CT scanners a day. We want to establish as this center as the center of excellence, because currently we are getting patients. We are at the tertiary level. We are getting patients from locally here in Uganda. We get patients from Southern Sudan. We get patients from Congo. We get patients from the neighboring countries like I mentioned them, Kenya, Rwanda, and everywhere. We can say we are center of excellence because PET-CT scans here, the nearest area we are sending people is India. So we think we can be a center of excellence. Then I talked of molecular imaging, which is actually more specific, and that's where all over the world, that's where researchers are, and that's an area which we are actually targeting.